So carcinoma, that is the major type of cancer we are dealing about. What is carcinoma? That is cancerous growth on the epithelial cell. Okay, this is carcinoma. What is the second type? Why sarcoma? So, what? Connective tissue. Correct? Connective, if the cancer grows on any connective tissue, then it is called sarcoma. And what is this? Lymphoma. This is a outside picture. It is not the cross section picture. So, what are the third type of cancer we are dealing with? That is lymphoma or myeloma or leukemia. Now, what is the cancer epidemiology? You all know for infectious disease epidemiology, there has been a vector, one host, and environment. But for non-communicable disease, what is the main question? That what is the disease, what the disease occurs in the population, what happens. Then coming to the who are the susceptible, when the cancerous growth or when the disease happens, the questions are different here. Here the question, first the general question, what happened, what happens. Next, the specific question are who are susceptible, when it is appears, and if it has any distribution. Okay, just like that, because Japanese people, they usually used to take only boiled and not properly cooked and not properly boiled even fish. They usually more suffers from stomach cancer. Stomach cancer, the incidence of stomach cancer is highly associated with eating sushi. You all know the name sushi. But now, because other culture or other continent people also are taking up their habit, the stomach cancer incidents are now spreading. That specific type of carcinoma, which was only previously limited to this area, now are spreading worldwide. And then come to the deeper question, why it is happening, why the disease is happening, and ultimate the final question, is there any way that we can prevent? Now just a little bit about the burden of the disease, because it changes every year in the park. Okay, so it becomes a potential important question, not the figure, but just remember the round up figure. Okay, cancer is the leading cause of morbidity and mortality worldwide, approximately 20 million, not 19.976. That is difficult to remember. Remember 20 million cases in 2025. Okay, that is existing cases. Sorry, new word is wrong. I will omit. Now the prevalence is 20 million almost in 2025. New cases, the number of new cases is expected to rise by about 70% over the next 2 decades. It is spreading more than any infectious disease. And it is also almost 10 million deaths in 2025, and it is now globally nearly 1 in 5 deaths is due to cancer. And it is the second leading cause of cancer second leading cause of death right now. And 70% of these deaths usually occurs in the low LMIC. Okay, it is low and middle income countries such as ourselves. We are previously very low income countries, but suddenly increase of our GDP, we are now middle. What are the most common cancers worldwide? Still the lung cancer is most common, followed by breast, colorectal, prostate and stomach. But the most common death, in which cancer the death has been highest, that is colorectal, then liver, then breast and stomach. Because we do not have that much treatment modalities that we have for lung cancer. Okay, in lung cancer there has been too much research, too much drugs that has been successfully decrease the cancerous growth, There are also many modalities, but in colorectum only two you will study, either surgery and then chemo. Both also weakens the pupil itself. In surgery, a part of your rectum and a part of your colon is rejected. You have to wear a stoma in the outside. High chance of infection. And chemo. Chemo itself is a poison. That's why the people falls to death. But the cause is attributed to colorectal cancer. That's why the death in colorectal cancer has been highest. Just remember, only the Asia zone shows the 2/3 of the cancer cases than the rest of the world. And the westernization trend, what is that? Before of that, in Asia, many countries were belongs to LMICs. So there was much more cases of CA cervix. Why? Because later you will learn in CA cervix the most common causes are early age of marriage, early childhood, early exposure to sexual intercourse, early menarche. Those were the things. But when the people are getting to adopt the Western culture, they are getting married late. They are taking they conceived later. So the estrogen comes to play, and the incidence of CA cervix has been decreased, but there has been increased in CA breast. Same goes by CA prostate or CA colorectal, because these people are now adopting the eating habits, the living habits of Western people. Eastern people are adopting the habit. That's why what cancer they did have previously, now are seeing in us. What is the burden of disease in India? In the year 2022, the number of prevalent cases. Just remember, in cancer, if the prevalent cases has been asked, so that the cases only the old case, new prevalence means what? The new plus old. But for old, only the last 5 years cases has been asked. Okay, not the cases diagnosed earlier. Now, top 3 sites for cancer in male, that is oral and lip, followed by lung and esophagus. And for female, breast, cervix, uterine and ovary. Here is the transition. In previous, if any of you have previous editions of PARC, it was cervix, uterine followed by breast. But what I said, due to the westernization, and also we are now introduced HPV vaccine, too much awareness programs on cervical cancer. There are also programs for breast cancer also, but for cervical cancer we have introduced HPV vaccine, we are introduced mass awareness campaigns. So now the sites have been interchanged. Now breast is the most common case of cancers, most common site for cancer, followed by cervix. Here also cancer is the second leading cause of death. In your textbook PARC, there are some demographic or there are some graphs, okay, which are age standardized graph. Read those graphs correctly, okay. There is the numbers and the prevalences of every cancer gender wise. Which cancer has equal distribution for both male and female? That is the question is there for you. I will ask in the next week. Okay. Read the graphs very carefully. Now coming to the causes of cancer. Okay. So what are the cause? We all saw that oral and lip cancer are the most common most common site of cancer for Indian male. Okay. And that is overall also. So first coming to the tobacco. Obviously. So what kind of, how we consume tobacco? Other than cigarette? chewing form, and also in chewing form there are two types. One is khaini, you all saw that making mixture, tobacco, betel nut, indica nut, and other things. And usually they either put it in their mouth and spit it later, let the saliva do their work, the absorption. Some people, they are that much addicted, they sleep with that. Just push the, what the constituents is there, push the side of their mouth and sleep. Studies have been showed, those who do that slept with tobacco in their mouth are 36 times higher to get cancer than those who are not. And those who are consuming chewing tobacco rather than smoking, they are 20 times higher to get cancer than the smokers. And smokers are 5 times higher to get cancer than non-smokers. And I think 2 times, 3 times than the passive smokers. Okay, this is the statistics. So, next, coming to the friend of cigarette, okay, that is alcohol. There are many debates that which alcohol causes more, either low alcohol content, beer, or high, that is whiskey or gin or any other thing. Okay, there are too much debates, but what cancers? Alcohol is the main cause of cancer in which sites? That is liver, followed by rectum and prostate. Now coming to the most common cause of colorectal cancer, that is red meat. Most commonly it is attributed to beef, but any kind of red meat, too much consumption can cause colorectal cancers. Now coming to the chemicals, there are too much chemicals, more chemicals in the environment that can cause cancer. What is this? This is asbestos. There are ether, benzene, chromium, cadmium, and much many more. They all can cause cancer. And what are the sites? What are the sites they are going into your body? Either by nose, inhalation, or by contact. So it can cause skin cancer. It can cause cancer in your total respiratory airway, or sometimes it can cause systemic cancers like myelomas, leukemias, etc. Now coming to them, some infections, they also cause cancer. Can anyone say what kind of cancer HIV cause? HIV causes what cancer? Very common. You actually read it in your adverse complication of HIV or AIDS, but that cancer is itself causes by HIV. Correct. Kaposi sarcoma. It actually came once. And also there are one common cancer we already studied, that is cervical cancer. It caused by virus. And one parasite is also involved. Anybody remember from parasitology classes? Schistosomiasis, schistostoma. What kind of cancer it causes? Now coming to some environmental, that is our old dear sunlight, it causing melanoma to some specific people, not all of us, and also estrogen. It is now the leading cause of doing breast cancer. I said that late marriage, late menopause, also introducing estrogen containing OCP, they are increasing the risk of carcinoma breast. Now, these are the environmental, and what is these factors? We can change these factors. These are modifiable risk factors. Coming to the non-modifiable, just some cancer, retinoblastoma is very commonly previously seen in mongoloids. Okay, In mongoloids, retinoblastoma are very much commonly seen and it was inherited. Some types of leukemia in Down syndrome. Okay, also there are also some leukemias which are inherited. These types of cancer are inherited, we cannot do anything on it right now. So, two types of causes. One is environmental, which are modifiable, and second is genetic, which is non-modifiable. So, for control, I actually put the common cancerous pathway for CA cervix. So, which way, if we label it 1, 2, 3, 4, in which part we can actually prevent, we should focus on. If from the left it is 1, 2, 3, 4, in which part we can, in which one, between 1 and 2 or 2 or 3, 3 and 4, where we focus on to prevent. Dysplasia appears. Types of prevention, what are the types of prevention? Primordial, primary, secondary. So, where if we say what is the primordial prevention for cancer, what we can do? Remove the risk factors. Then if the risk factor exposure is there, what we can do? That comes to between the normal epithelium and dysplasia, primary. And if sometimes dysplasia and carcinoma in situ are very much closely related, so there will be secondary, and if carcinoma in situ happens, there will be tertiary. Because invasive cancer, that is what we do, palliative, okay, after treatment. Just remember, 1/3 of all cancers are preventable. Then what are the primary prevention? That means primordial is very tough. What are the primary? First, control of tobacco and alcohol consumption. For that, we have one legislation, that is KOTPA Act. Okay. সিগারেটের গায়ে এত ছবি দেওয়া, মদের গায়ে বোতলের গায়ে বড় বড় করে লেখা alcohol, consumption of alcohol injurious to health. Those are part of it. Okay. Now coming to the personal hygiene, how we can promote mass campaign, mass awareness, billboards, everything. Just remember, when it will come as a long question, you have to write like that. Otherwise, teacher will not give number. What to do for prevention of any cancer? Then come to the radiation. Radiation hazard से निकलना है क्या? To use the PPE, where it has been there is chance of exposure. Coming to the occupational exposure, I think ESI Act has been taught. ESI or Factory Act, both class happened or not? Okay, there you will see what are the measures has been taken to for prevent occupational exposures. Then coming to the immunization, just one example, HPV vaccination. Okay. Now coming to the foods, drugs and cosmetics control. Just control of food quality, that if people are just eating sushi, just try to maintain the quality. Same goes for drugs and cosmetics, especially cosmetics. There are some very cheap cosmetics where hazardous chemical material has been used, because those are cheap to obtain. Those has to be regulated. Now coming to the air pollution. Remember, there might be a potential question. What are the behavioral factors responsible for non-communicable disease? Okay. There are 5, previously there was 4 points. Now the 5th point has been added last year in the modules. Not your park or everything, the central ministry module, from where usually teachers make the questions for your upcoming any MCQ exam or anything. That is air pollution. Indoor air pollution has been added as a behavioral risk factor for NCD, any NCD. Okay, so it might ask in any upcoming exams or even Viva also in your finals. And also screening for precancerous lesions. So, any dysplasia for cervical cancer or any dysplasia for breast cancer, this should be screened accordingly. And finally, legislation. Legislation for what we already saw, there are some, these primary preventions are all legislative. But there are some separate legislation we should make. It is not there actually. We should make to get treatment to every cancer patients. And also cancer education. Just there is a one very much effective way to prevent breast cancer, that is breast self examination. Okay, so we should taught this to uneducated people or those who doesn't know, so they can usually just feel something, okay, there is something hard nodular in my breast, I should went to the doctor, I should not ignore it. This, this is the only simplest thing, and this is the most effective way to prevent cancer, that is cancer education. Now, our secondary, that means already cancer happened. There is one potential short note for your examination, that is cancer registry. Okay, what kind of cancer registry is there? It is very much well written in part, so I didn't cover it. It is easily understandable. Two types of actually there. One is population based registry, another is hospital based registry. Right now there are 103 population based registry all over India, and more than that hospital based registries. What are the what are the difference between population based and hospital based registries? In population based registries, only the incidence and prevalence and the data on exposure we can get. But in hospital based registries, we usually there is follow up, because there is treatment. So what type of treatment is effective for which type of cancer, it is available from hospital based registries. And what is the norm, minimum people norm to get a population based registry, that is 2 to 3 million. Okay, these are the MCQs, it can come. And also secondary prevention, early detection of case, the treatment, and if the treatment fails or after that, there are palliative care. For palliative care, we also have one national program, that is national program for palliative care of the cancer and geriatric people. Okay, anybody has any idea what palliative care means? What are the palliative care? Hospice term, you know anyone? What is hospice? Palliative is nothing. If there is no treatment, we will try to make this as much smooth as possible for the rest of his life. Okay, nothing else. There are no treatments for their actual cause, only symptomatic treatment. আজ ব্যথা হচ্ছে, ঠিক আছে প্যারাসিটামল খাও, কালকে অন্য কিছু হচ্ছে, আচ্ছা তুমি সেইটার ওষুধ খাও। যে ক্যান্সারের জন্য হচ্ছে বা কোনো কারণে হচ্ছে, তার আর কোনো চিকিৎসা নেই, একদিন মারা যাবে ঠিকই, যতক্ষণ না মারা যাচ্ছে ততক্ষণ যাতে একটু আরামে থাকতে পারে, অনলি সেইটুকু, ঠিক আছে, দ্যাট ইজ প্যালিয়েটিভ কেয়ার। So it is a very important short note for your and so Viva question. What are the warning signs of cancer? It's taken from PAR. Remember every point, because it previously it came as MCQ and teachers love to ask it during your Viva. All the points: lump or hard area in the breast, change in any existing water or mole, persistent change in digestive and bowel habits, persistent cough or hoarseness of voice, excessive blood loss at a monthly period or loss of blood outside the usual dates, blood loss from any natural orifices, a swelling or sore that does not get better, and unexplained loss of weight. Okay, the warning signs. What type of if I how we can use it to prevent cancer? আমি এই ওয়ার্নিং সাইনগুলো জানি, এবার আমি এটাকে কিভাবে ইউজ করব অ্যাজ এ পোটেন্সিয়াল টুল টু প্রিভেন্ট ক্যান্সার ইন দ্য পপুলেশন। কি হতে পারে বলো? কিন্তু পিজিআই আসতো এরকম কোশ্চেন, মাল্টিপল অপশন এখানে কারেক্ট হতে পারে, দেয়ার ইজ নো সিঙ্গেল কারেক্ট অ্যান্সার। আমি এগুলো জানি, এটাকে আমি কিভাবে ইউজ করব আমাকে পরের দিন বলুন। পাওয়ার পেলে মানুষ কি না কি করে দেয়, তবে পাওয়ার দিচ্ছি, নলেজ দিচ্ছি, তারপর ক্যান্সার থামাতে পারবে না। So there are some specific cancers that has been discussed. This also in part and very much less so. You will learn these individual cancer in your surgery classes, but some just points that is important. One is oral cancer. It is the most common cancer linked to tobacco and betel quid. Early detection possible. Why? Because what are the earliest manifestation of oral and lip cancer? Erythroplakia and leukoplakia. And what is the period between appearing erythroplakia, leukoplakia and oral cancer? 15 years, the mean duration is 15 years. So তাহলে আমি in between যদি আমি erythroplakia, leukoplakia হচ্ছে কোনোভাবে নোটিস করে যদি তাকে অ্যাওয়্যার করতে পারি, তাকে যদি তার এই নেশাগুলো ছাড়াতে পারি, there are some chances of not happening the carcinoma in situ for that person, oral cancer. And also there are newer type of cancer that has been emerged, that is epidermoid carcinoma of hard palate. এটা কাদের মধ্যে সবচেয়ে বেশি দেখতে পাওয়া যায়? যারা সুপুরি হচ্ছে কি খুব বেশি খেতে ভালোবাসে। Okay, so the betel nut, the juice of betel nut is also probably carcinogen. And what are the precursors? It detected the 15 years prior, what I said. And what are the lessons? What I said, this 36 times, what I said, that those who usually chew the tobacco and sleep on it, on the particular side, so are 36 times to get cancer than those who are not doing that. Okay. And what are the preventive part for oral cancer? Same, just remove the exposure things by hook or by crook. Either you can ban the production of betel nut, okay, if possible. You can ban the production of chewing tobacco, and also your salary will decrease, okay, because the government use the revenue from cigarette, alcohol to make the salary of government employees. Okay, for India it is very much true, because we do not have any government product which is selling. But those are the ways. Cervical cancer, it is caused by HPV, human papilloma virus. It is sexually transmitted. Right now, cervical cancer is cause of 7.1% death of all 7.1% of all female cancers. 94% of deaths are in low and middle income countries. And what are the prevention? HPV vaccination and early screening. Early screening, you all know, that is VIA, visual inspection under, what is the A? Your gynae class also happens, na? Cancer cover হয়নি? Okay, that is A is acetic acid. Okay. And third, coming to the breast cancer. Right now, this is the most common cancer globally and also India. 25.8% cases per 1 lakh population. What are the risk factors? Early menarche, late menopause, obesity, alcohol, family history, and also we are know one gene that is responsible for breast cancer. What is the name of the gene? Genetic factor responsible for BRCA. BRCA 1 and 1 and 2. Okay. And what are the prevention? So coming to the same, breastfeeding, physical activity, weight control, early detection. What are the early detection? That is BSE. Also we have some technological advancement, that is mammogram. Okay. And for treatment, we have also some chemos and mamma print. You will all learn it in surgery. Okay. Breast cancer is a huge topic. Coming to the most common cancer for the male, that is lung cancer. What are the main cause? 80 to 90% it is attributed to smoking. And what are the prevention? Anti-tobacco campaign, legislation, cessation program, treat the patient, treat their addiction, everything. What are the survival rate? That is very much poor now. 2 to 3 months without treatment, 10 to 14 months with chemotherapy. But there are now one also modality, that is resection and replacement. Resection of the cancerous lung and lung transplant. It is a very effective way to beat the cancer now. Okay. Not many cases has been happened in India, but in outside there are too much cases of lung transplant. So there are one way to prevent your cancer. Last, coming to the stomach cancer, it is linked to diet and H. pylori infection. There are no in your surgery you will if you see any case, there are actually symptoms, some specific, that is uh, metabolic acidosis with what was the term? There was the acidosis, and in urine there was some alkalosis with aciduria, and also in visible peristalsis. That is the very most very prominent sign of any stomach cancer. Okay, there was, and there was also too much vomiting, because there are some blockage. So the when the food passes from the cancerous to the next non-cancerous area, the patient will show you the peristalsis visibly. You can see the peristalsis. That food just pass from one point to this point. And যতক্ষণ না ওইটা হচ্ছে, পেশেন্ট হচ্ছে গিয়ে প্রচন্ড ব্যথায় ছটফট করবে, কিছু খাবার খাবে, খাবার খাওয়ার পর খানিকক্ষণ পড়বে আমার পেট ব্যথা করছে, পেট ব্যথা করছে। যতক্ষণ পেট ব্যথাটা থাকবে, যতক্ষণ না ওই ক্যান্সারাস এরিয়াটা খাবারটা পেরোচ্ছে। এটাই হচ্ছে স্টমাক ক্যান্সারের স্পেসিফিক ইয়ে। আরেকটা ছিল, এখন আমার মনে নেই সার্জারির পয়েন্টে। অ্যান্ড হোয়াট আর দ্য 5 year সার্ভাইভাল? ভেরি লেস দ্যান 20%। মানে এই যে বললাম এত কিছু কাটাকাটি হবে, ইয়ে হবে, জাস্ট লাইক কোলোরেক্টাল, the patient will die very much early. Now coming to the program, that is we have one giant program that names NPNCD, okay, which is previously named as NPCDCS. Now we have taken much more diseases under it, and one umbrella program, that is NPNCD. What is the NCDs right now? It's treating, that is cancer, diabetes, hypertension, cardiovascular disease, stroke, chronic respiratory disease such as COPD, chronic kidney disease, and non-alcoholic fatty liver disease. Alcoholic fatty liver diseases were usually there, but non-alcoholic, because females are now showing too much prevalence of NFLD. Okay. What is the cause? We right now do not know. We are doing research on it, if it is any way attributed or associated with their lifestyle or not. Okay. So NPNCD, previously NPCDCS, it was launched in 2010. It is the program aims to prevent, control and manage common NCDs
তখন পরীক্ষায় আসবে না যে কোনো একটা প্রোগ্রাম বলো যেটা স্পেসিফিক এইটা সম্বন্ধে করছে, কয়েকটা জিনিস মনে রাখার চেষ্টা করবে, ওইভাবেই লিখবে। ফার্স্ট লঞ্চ ইয়ার, আর প্রত্যেকটা প্রোগ্রাম কিছু না কিছু স্পেসিফিক মিনিস্ট্রির আন্ডারে থাকে। কিছু মিনিস্ট্রি অফ হেলথ অ্যান্ড ফ্যামিলি ওয়েলফেয়ার, কিছু মিনিস্ট্রি অফ লেবার অর্গানাইজেশন, কিছু সামথিং, সেইটা লিখবে। এম অ্যান্ড অবজেক্টিভ লিখবে, চাক বা না চাক। দেন হোয়াট সার্ভিসেস ইট ইজ ডেলিভার্ড। ওইভাবেই টিচাররাও দেখতে চায়। তোমাদের আগের ব্যাচের খাতা হচ্ছে যখন তোমাদের স্যারেরা দেখছিল, নট অফ দিস কলেজ, আদার কলেজ, আমি দেখেছি। ওগুলো না, ওগুলো যদি দেখতে পায় সঙ্গে সঙ্গে নাম্বার বসাবে, এবং দ্যাট উইল বি মোর দ্যান 7। আর যদি না দেখতে পায় তখন একটু পড়ে দেখে, আচ্ছা কতটা হলো, 5 কি 6। তুমি যদি এই ফরম্যাটে লিখতে থাকো প্রথম থেকেই, অভ্যাস করো, নিজেদের নোট বানাও, 7 প্রত্যেকটার ক্ষেত্রে। Now what are the NPNCD focuses on? That is integrating NCD services at all levels of healthcare and the strengthening primary healthcare service under Ayushman Bharat Health Initiative. And one thing we always it is also remembered that in which SDG this communicable and non-communicable disease comes under. Always remember those SDGs. Okay, it can be asked in MCQ. That is for for NCDs it comes under SDG 3.4. I think in TB and other communicable disease comes under 3.3. And what are the cancer screenings we are that those are available under NPNCD? That is first population based screening for oral cancer, breast cancer and cervical cancer. Okay, usually those screening are focuses on those who are those of those age, male or females, those who are individuals usually more than 30 years and above. There are now for rule for any 30 years in any PHC or block level PHC or any higher. If a person more than 30 years of age comes to you first time, you should recommend him MBBS, PPBS and also cancer screening based on whether he is male or female, and then the reports and the check-up of blood pressure twice weekly. Okay, this is the mandatory thing for under NPNCD. And also confirmed early detection and screening to identify pre-cancerous or early cancer stage and manage accordingly. And if there are any confirmed case that those people diagnosed, they usually refer it to higher center. Okay, these population based screening are done by whom? Or ASHA workers. No one less. The ASHAs were actually trained to recognize the pre-cancerous lesions. Usually they get very better at it, more than us sometimes. What are the cancer care includes? The same surgery, radiotherapy, chemotherapy and palliative care, focusing on improving quality of life for patients. কিছু করতে পারলাম না, জীবনটা একটু সুন্দর করে দিলাম, আর কিছু না। And also there are some right now day care centers for chemotherapy at district hospital to support continued chemotherapy. এটা কিছুই নয়, কেমোর জন্য ইউজুয়ালি পেশেন্টকে ভর্তি হতে হয়, তারপর হচ্ছে কেমোর ইন্টিমেশন যেত। অ্যাটলিস্ট আমাদের সময় মেডিকেল কলেজে তাই হতো। তো পেশেন্ট একদিন আগে ভর্তি হতো, তার জন্য ইন্টিমেশন যেত যে এই কেমো দিয়ে হচ্ছে গিয়ে আগের দিন যেমন পড়েছিলাম ওই সেন্ট্রাল মেডিকেল GMSD, ওরকম কোনো জায়গা থেকে একটা সাপ্লাই আসতো ড্রাগের, তারপর তার চালানো হতো, তারপর তাকে ছাড়া হতো। একটা পেশেন্ট 4 দিন বেড দখল করে রাখতো। বাট ডে কেয়ার সেন্টার ফর কেমোতে কি হচ্ছে, পেশেন্ট আগের থেকে তাকে ডেট দেওয়া আছে যে তুমি এই ডেট প্লাস মাইনাস 1 ডে, সাপোজ 13 তারিখ যদি ওর ডেট আছে তাহলে 12 থেকে 14 মধ্যে তুমি আসবে। ও হচ্ছে গিয়ে আসবে, ওকে শুদ্ধ হচ্ছে গিয়ে বেডেও বসাতে পারে, বেডেও রাখা হতে পারে, অথবা চেয়ার দেওয়া হয়, চেয়ারে বসো, কেমো চালাও, সকালবেলায় হচ্ছে গিয়ে ঢুকে যাও, কেমো চললো সারাদিন। যদি মাল্টিপল সাইকেল থাকে সেক্ষেত্রে হয়তো ভর্তি করতেই হবে, সিঙ্গেল সাইকেল হলে কেমো চললো, বিকেলবেলায় সে বাড়ি চলে গেল। বেশিরভাগ ক্ষেত্রে পেশেন্ট নিজেই বাড়ি যেতে পারে, তাও বলা হয় কাউকে একজনকে নিয়ে আসতে। It was previously in foreign settings, now we are adopting it, day care center. Now also financial and infrastructure support is provided under NPNCD আর আচ্ছা, এবারে বাজেট কেউ দেখেছে? বাজেটে কোন হেলথের উপর এবার জোর দিয়েছে বলো তো? মেন্টাল হেলথ। আর WHO মেন্টাল হেলথ হচ্ছে গিয়ে কোন ইয়ারে হচ্ছে গিয়ে বলেছিল যে মেন্টাল হেলথ ডিপ্রেশন লেট স্টক। দেখেছো কেউ পোস্টারটা? 2017 সালে, ঠিক আছে। 2025 সালে ইন্ডিয়া গভর্নমেন্টের মনে হলো না, সরি 26, যে আমাদের মেন্টাল হেলথ নিয়ে এবার তাহলে কিছু করা উচিত। এতটা আমরা পিছিয়ে আছি। অ্যাকচুয়ালি তোমরা তখন পড়তে ঢোকনি তাই তোমরা দেখোনি, বাট ডিপ্রেশন লেট স্টক এই পোস্টারটা খুবই সেই সময়ের ক্ষেত্রে খুবই মানে ভেরি মাচ needed right then. And also there are various levels. What are the services available in primary health center? That is screening and referral. For community health center, further diagnostic services such as colposcopy and cryotherapy. Cryotherapy you will read in CSRVs, okay. And also bidirectional referral with district hospital and tertiary center. What district hospital can do: the final cancer diagnosis and management, palliative care, dedicated NCD clinic for follow-up, day care center, and also the linking with tertiary center. We have one only tertiary cancer center in West Bengal, that is CMRI, okay, Chittaranjan. That is the tertiary center for cancer. This is a provide comprehensive cancer care for prevention, early detection, diagnosis, treatment, palliative care, and also rehabilitation. These are the cancer cares at various levels under NPNCD. And how we linkage with others? There are financial assistance. There are we can help the state cancer institutes. Their monies are not needed, and we also can help the tertiary cancer care center. Also Tata Cancer Care Center is there, na? Tata, that is also one cancer care, but not government, that is full private. We can help those even. And also we can funds to support the procurement of radiotherapy equipment, diagnostic equipment, surgical equipment, infrastructure enhancement for cancer diagnosis, treatment and care. We can also focus on the health promotion. There is community education on cancer risk factors such as tobacco, alcohol use, unhealthy diet, physical inactivity, air pollution also. Just remember, for unhealthy diet, India government has launched that movement, okay? Eat Right India, okay? Search, আর যারা ফ্যামিলিতে এসেছিল তাদেরকে একটা আমি NIN এর দেখালাম, ওর মধ্যেই হচ্ছে আছে হোয়াট ইজ দ্য মাই প্লেট ফর দ্য ডে। ইভেন আই থিঙ্ক লাস্ট পার্কেও ওটা অ্যাড করেছে এই নিউট্রিশন চ্যাপ্টার, মাই প্লেট ফর দ্য ডে। দ্যাট ইজ কামিং ফ্রম ইট রাইট ইন্ডিয়া মুভমেন্ট, ওকে। ইট রাইট ইন্ডিয়া মুভমেন্ট ঘুরে শর্ট নোট হিসেবে আসতে পারে। And for physical activity, Fit Right India movement, Fit India movement. There are some modules age wise and also gender wise. Now, how much physical activity you should have done, you should do to prevent any other disease, cancer or stroke or obesity, everything. And we for NPNCD there are also data and monitoring in the national NCD portal, and also there are national cancer registry and others, cancer screening, diagnosis, treatment data, and ABHA ID, আধার আইডির মতো আভা আইডি, যেমন স্বাস্থ্য সাথী কার্ডে হচ্ছে কি তোমাদের একটি আইডি আছে, তেমনি আভা আইডি এটা হচ্ছে গিয়ে আয়ুষ্মান ভারত যারা করেছে তাদের মধ্যে হচ্ছে তাদেরকে এই আইডিটা দেওয়া হয়, ইউনিক নাম্বার। তুমি আভা আইডি দিয়ে তুমি তোমার যদি আভা আইডি থাকে তুমি ইন্ডিয়ার যে কোনো ইয়েতে আয়ুষ্মান ভারত কিছু হোক ইউ উইল গেট ট্রিটমেন্ট অ্যাট ফ্রি অফ কস্ট, ওকে। যেমন হচ্ছে চলে যেগুলো আন্ডারে আছে ইনসিওর্ড আছে বা আভা আইডির সঙ্গে লিঙ্ক করা হচ্ছে ক্যান্সারের ফলো আপ। এই ছবিগুলো দেখে রাখো, তা আমিও জানতাম যখন কোথায় সবুজ এলে কি হয়, এই কি হয়, উদ্যম জিজ্ঞেস করতে পারে, যে কোনো সময় পিকচার বেস MCQ আসতে পারে। যেমন আমরা এইটা জানি সবাই, কেননা এই অস্ট্রেলিয়ার কোন নিয়ে হচ্ছে গিয়ে পরে এটা একদিন পরে নামে তো খেলতে গ্লেন ম্যাকরা ছিল, তার বউ হচ্ছে ব্রেস্ট ক্যান্সারে মারা যায়। তারপর হচ্ছে ওয়াইফাই ইয়েতে তো হচ্ছে ইয়েটা চালু করে। এইডস এর জন্য হচ্ছে গিয়ে একদিন সাউথ আফ্রিকা ওদের টিম জার্সি করে খেলতে হবে, কারেক্ট না? But there are also these color. I don't know what teal means, but this is for ovarian cancer. Clear, if the ribbon is clear, then it is lung cancer. Purple for pancreatic and leiomyosarcoma. Orange for leukemia. This red, not red, this is burgundy red. That is for multiple myeloma. Also this one, violeta red with অন্যদিকটা হলুদ. That is ivory, head and neck cancer. Lime color যদি হয় lymphoma. If you can remember it.